So we're going to talk about how to prepare vaccines. And generally we have two types. We have the ones that come in the vial, and then we have ones that comes already in a syringe. So you got a vial and you have a syringe. Actually, there's three types because some of the vials have liquid in it. Some of the vials have powder. This one has powder, this one has liquid, and then this is a syringe. So those are the three types of And then this is kind of what the doctor will need for each of these situations. This one's the powder, this one's the liquid. For the syringe one, all you need is to give these two. That's one set. Because this is a needle, the doctor will just attach it to there and they'll be able to inject. Oh yeah, so that's here, the mixed needles. Thanks, Anjali. Is it Anjali or Anjali? How do you say it?
It's, well, the actual way to pronounce it. So it'll be like Anjali.
Anjali, thank you.
That's how you say it, yeah.
Anjali.
But other people call me Anjali. I don't really mind, but...
Anjali,
yeah.
Thank you. So this is the powder. For things with powder, of course, you can't pull up powder into a syringe, so you actually need what's called a diluent, which is just a liquid to suspend it. Diluent comes in a few forms. This is one of the common forms of diluent. So this is just sterile water. So it means it's water that has been boiled, and then the doctor would need that to mix that together. This is another form of diluent. It's actually no medication here, it's just boiled water. So these are the two options for diluent for powdered format. Okay, so those are two options there. And for which needles would a doctor need there? The reason these are good is because they have threading there. Threading means that the needle can attach to the syringe. This is called a syringe, not a needle. The needle is, of course, here, the pokey part. Because there's threading that allows the needle to stick on well. And then the doctor will use this to puncture either into the rubber seal that's on this one to pull the water out. Then the doctor will use that needle again to inject into here, into the powder. And then the doctor will mix it around and then pull up the fluid into the syringe so it's loaded. Because this needle will have punctured both this rubber and this rubber, or if you're using this one where it just breaks in half to open, it will have just punctured this rubber. That one puncture reduces the sharpness of the needle. And if your needle is sharp, it'll have less pain and less force as it enters the skin. So for patient comfort, we often grab another one of these needles and we'll switch the needles into that threading because they both screw on to that threading. And then for injecting, that's what you'll need. So you'll either need this set for the powdered version, or you'll need this set for the powdered version. There's this one, Pneumovax. This one comes pre-mixed, so there's also already suspended vaccine in there. What you would need for that one would be one of these and one of these. So that's that set. With all of these sets, one thing that would be nice for you to prepare for the doctor would be a Band-Aid and an alcohol swab. If you put a Band-Aid and an alcohol swab, then this is a complete and ready to go.